These are instructions for the RightSpot infant pH indicator. Turn off feeding supplement if the infant is receiving feeding. Clear the NG tube with air. The amount of air used needs to be determined by the clinician. Cap the NG tube. Wait 60 minutes. Prior to the next feeding, pull back on the lower locking syringe 0.5 mL. Attach the syringe to the RightSpot infant device. Open the NG tube and attach the RightSpot infant device. Insufflate 0.5 mL of air to remove the tip of the NG tube from the stomach wall. One can auscultate over the epigastrum during this step. Aspirate stomach contents until the indicator changes color. The color can be compared to the reference colors on the device. It is up to the clinician to determine what pH would indicate gastric acidity.
It is important to note that pH should be used in a combination of other methods to increase the accuracy and approach the accuracy of an X-ray. According to the Emergency Nurses Association and the Association of Critical Care Nursing, one should obtain the distance of the tube for stomach placement, auscultation over the epigastrum, view the color of aspirate to see if it appears to be gastric, and verify with pH. One can use the RightSpot pH indicator to verify with pH. The specimen is estimated to be stable for 2 to 5 minutes at room temperature. Grossly bloody samples cannot be used. Specimens with coffee ground emesis can be used. Interpretation of the test should not be done by one who is colorblind. This test is designed to be used by qualified medical personnel as an aid in professional diagnosis. Water or feeding supplement may change the reading. Caution should be used when using sips of water to place tubes in conscious adults. Attention should also be given as to what medication the patient is taking. In one study of patients that were on these medications, pH was able to be used around 60% of the time. The effect of raising pH of the stomach aspirate by proton pump inhibitors and H2 blockers usually lasts less than 6 hours. If a patient is on medication that raises the pH of the stomach aspirate, like proton pump inhibitors or H2 blockers, then the pH of the aspirate may not be below 4.5. An X-ray would be needed to verify placement.